colon cancer and metastasized in his lung and a little spot in his liver. We hope after all this treatment that we're going to give it's going to be eradicated. Can you hear me now? No?
In the shirt.
Okay, can you hear me now? Yeah, so we hope that, and we choose the drugs that will be able to nano it. So we are using nano doxorubicin, which is Doxil, and we're going to use low dose, and we're going to activate it with blue light. We also use ICG, andesine green, nano, and that will be activated with infrared. And we use curcumin, also nano, and that will be activated with blue light. And now we're going to use also methylene blue, and we're going to activate with red light. So we have 3 lights, and we're going to activate all these drugs. So it is low dose photo-activated chemotherapy and photosensitizers combined. I don't know, I did the test for cisplatin and he's not sensitive to it. But still, a microwave is a good idea because it will heat and increase the metabolism and the reaction of the chemo with the cancer. So I would definitely recommend it, and also we have the advantage of microwave going deep. So I think we will do it on his liver. He has a spot there, microwave, and I will be putting his light into his esophagus to radiate the inside as much as we can using red and infrared. I'm not going to use the blue because there's not much penetration and esophagus is clean. If I have esophagus cancer, I will use the blue. But because it's clean, I will just use infrared and red. We can just do IV for him for blue light to activate the Doxil. That's fine, but I don't see much of advantage of doing the blue light in his chest unless we say we're going to activate the blood that's in the esophagus and that possibly activate the Doxil. But we will do infrared and red, and yes, we can do the blue, assuming that we are activating just the blood. We are not assuming that we are activating the drug of the cancer in the liver because blue light does not penetrate there. The red light does give you 1 to 2 centimeters, which gives you the lymph nodes that surround the esophagus that relate to the lung, possibly. The infrared can go up to 3 to 4 centimeters, so hopefully that will cover area of the lungs. I also recommend to do infrared and red on his chest from outside, so we can cover that. But we need to have the high power infrared. There is out there 30 watts. We can do it pulsed, and then we can do it from outside. So that's maybe in coming days or weeks we will have that system as well. So we have light from inside and from outside. We have the microwaves. Hopefully all of this will help to destroy the cancer and will be completely in remission status. So this is curcumin. It's and I think we already gave him other 3 drugs. And basically, when we start thinking about cancer of lung, we start doing it through the mouth. But you have the gag reflex, try to get it through the trachea, and the only way you can do that is by anesthesia. So, and I saw Dr. Weber is, in Germany, is struggling a lot with that. So we changed the whole thing and told him it's better to do it through the esophagus. So we tried to do it through the mouth. So, they got the gag reflex again. It's a problem. So the best way is do it intranasal, and you go all the way to the esophagus, to the stomach without any problem at all, no gag reflex, everything will be easy going there, and it will reach out to his esophagus. I will try to push it to get into the stomach, but I'm not sure it's there or not because I can't see it. The only way we can see it is by using transnasal endoscopy, and that's something I will recommend Luna to have it, because if we have that, we can do also intratumor injections of any stomach cancer or esophageal cancer. So it's something good for the practice itself, but also it helps us to see what's inside and helps us make sure that we are getting it into the stomach. And if we can radiate the stomach, it can reach the liver and possibly irrigate the esophagus. Definitely will get some light into that. You want to sit? So you can swallow. You want to sit?
It's just going this way because of the drip.
Yeah, that's fine. I'm going to do it on your left side because you may have. I see it's nasal deviation for sure. You do have. You see that like
He's
this?
got a broken nose. This.
Yeah. So sometimes you have nasal deviation. One side will be difficult to get easy as the other side. So hopefully.
Slip. Slip. Slip.
Is it in your mouth? You feel it? No? Not yet? Yeah. Okay. So I can see the light here in his throat. Okay. So if you go and you have the dark area, you can see light is coming up from his throat. It will be good, but yeah. So if you want to see it, just put down under here. You can see the light here. You want to see it? Here. See that? So now that we know it's there, it's at this level. See that? And now I push it all the way to here. So that's for the esophagus. Swallow. 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 Until the light will disappear. That's mean we're getting into the esophagus. So it's not there anymore, right? Swallow. 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 So there's not much light there left. That's mean it is in the esophagus. And we just do like, you can type it. And we're gonna do the 3 lights, but remember that the blue light is not to really get into the lung, cancer, liver, but just activate the blood that's around the esophagus. Hopefully that DOXA will be activated and gets into the cancer area active. Possibly kill those cancer stem cells that's circulating the blood as well. And yes, I will recommend doing microwave if we have it here, right? So we're going to do it in his liver side and his chest, both sides, just to heat the whole thing. You have a tape?
Yes, the liver side.
Okay. And we will keep it 30 minutes for each color. Yeah. I want to do it here because sometimes it will be one thing.
There we go.
Great. Okay, can we relax now? Oh. Yeah. Yeah, so you want to go ahead and
أنا ماشي
the area of
بلوى أنا ماشي بلوى.
Where do you want to put?
So let's do, yeah, let's start with the lever. And put it, can you put it here?
Right, like this?
Do you know where the lever was in the CT scan?
Section 8.
Section 8. I think that would be a good place to cover the whole lever there. You have the power? And so the microwave does penetrate the whole body?
15 centimeter.
15 centimeter. Okay.
And the volume is 10 centimeter.
Oh, good.
Like
Good. That's good. Yeah, 15 centimeter. That's
it's like this.
fine. So that's good. Yeah, red, the metal blue. Uh-huh, yeah. Right, so, yeah, I did tell.
And you change the,
Yeah.
it's not working.
In the lung, do you remember it has the spot where was it? The lung? Right or left?
No, right lung?
Right lung?
Both lungs, both lungs.
Both lungs?
But the big tumor on this is on the right side, on the lower level.
Is it lower level?
Lower level, yeah.
Okay, so we
At
do,
the end of the,
Yes, lower.
almost here.
That's right.
and the liver,
And the liver is
and then
also-
we will do it here again for this side after. How many, what do you recommend the timing for?
We
Okay.
do
It's every other day.
No, the timing of
1
placing
hour.
it.
We
1 hour.
have to stay 1 hour.
1 hour on one side?
Yes.
Both sides together, 1 hour.
You have to,
Okay.
We've got 2 probes.
Okay, good.
But Dr. now we need to put this on.
you want to do the 2 fronts or 1 at the moment?
No, we will put 2
We will
probes.
do 2, yeah. If you have another one, yeah. no
And that
problem.
one here?
Yes.
You must sit up
Yeah.
straight, I just want to put
So
on
we
the
cover
strap.
both the lower lung and the liver, yes.
The lower,
Yeah.
it's a lower right or lower left?
It's lower lung, lower
both.
left.
Both right, lower left.
Right. And that will also cover the liver as well, the right knee.
Yes.
Left knee, right. Okay.
Oh, you started already?
Mario,
Any questions? Everything is good?
this evening, see,
Now, Madeline Blue can mess up with the microbiome. So you need to go to Dr.
Yes.
Katrina, she can fix the microbiome.
You activate the,
Right.
All right.
Yeah.
Can I use the booster now?
ja, bei Danke.
you can, but it's strong enough, right?
The other thing for people has Helicobacter pylori in the stomach, if the antibiotics did not work for any reason, then we will recommend methylene blue, taking it orally along with curcumin orally, and see what would happen. If it takes to even do a nasal activation of the methylene blue and curcumin in the stomach to get rid from it, we can do that because methylene blue does kill Helicobacter pylori. But let's give the antibiotic a chance, 14 days, and if we find it's not working, then we have another answer for it. Do you feel the heat?
Yeah.
You feel the heat?
Show me.
Yeah. Right.
In this stakeholder.
Yeah, and I think ICG and methylene blue do sense microwave, but I need you to do that study on that from the microwave if they're sensitive to it.
Yes.
You know you're using a cystatin, but some patients they are not sensitive to it, so maybe we can see the other one. I know methylene blue and ICG are radio sensitive. That's for sure for X-ray. So in case after all this treatment and we don't see much improvement,
Radio sensitive.
X-ray.
Means X-ray,
Yeah.
and also they are from the same family of X-ray. This is
No, microwave is
non-ionization, and the X-ray is ionization.
Yeah, but microwaves are long wavelengths.
Yeah, but the same family.
X-ray is short wavelengths. You know,
Sure,
like,
absolutely.
microwave is like almost, but then you have radio after that.
Yeah, it's a few centimeter, and the other one is
That one
nanometer.
is like less than 10 nanometers.
Yes.
Right. But if I need you to make sure it's sensitive because if that's the case,
Yeah, the sensitivity of the radio is the same. If the X-ray is sensitive,
so the
this
microwave
means
sensitive.
microwave will be sensitive
Okay,
too.
good. So I know for sure the ICG and
100%.
methylene blue is sensitive because we use it for angiogram for ICG, and methylene blue it is radio
That's
sensitive.
why. If it's radio sensitive,
Then it's microwave sensitive. Okay, that's good. But in addition, microwave, we're not just doing it to sensitize the drug. There's other factor of it. It just heats the area and because more accumulation of the drug and
and
the reaction.
polymerization of the drugs.
Yes, and the reactions of the drug, exactly.
Increase the drugs.
And possibly it generate the free radicals as well.
Yeah.
Same like photodynamic or sono or there are energy that helps to.
We generate interferon alpha
Uh-huh.
and also free radicals from oxygen.
Yes. Once you generate the free radical, you'll be shifting your immune system into inflammation, which is T1 and M1, which helps to activate the immune system to kill the cancer.
It's okay for the temperature? Not too hot?
No, nothing.
Now actually it's 41 inside.
Oh, that's good. Right. And make sure the cancer, because they are very tricky, and they have the capability to adapt and evade, especially the cancer stem cells. One of the worst things when you have cancer stem cells, and that's why when the cancer comes back, most of the time that comeback is cancer stem cells. And the cancer stem cells do behave like normal stem cells. They have very powerful antioxidant capacity, almost like the normal cells. So it's really hard to get rid from it. But curcumin does increase the sensitivity of cancer stem cells to all the chemotherapy and the photosensitizers. So it's very important that curcumin will be part of the regimen and all your chemo or photo. And having it, if you are not able to afford it IV, take it orally, but make sure you're taking phytosome, nano-delivered, so you can get that clinical concentration into the blood. IV is the best, but in case that the patient cannot afford it, they can go oral, but they have to make sure that it has the best delivery. And you continue curcumin forever, no stop. Curcumin, because we're using low dose chemotherapy and we're activating it into the area of the problem, most of the time you don't get any side effects of the chemo. This is low-dose chemotherapy. According to all the recent publications, they are rewriting chemotherapy regimes, and they're using low-dose, activated, nano. So the regimen that we have currently in traditional medicine is the 70s and the 60s. Nothing changed. I think 10 years, 20 years from now, the whole regimen will be changed completely with all this new discoveries that we have.
Now it's 43 inside. Is what?
No,
It's normal.
in Holland is het winter.
Yes, 43. But you feel the warmth.
Veel.
And now, if I do this,
Yeah,
Less.
it's a little bit sharp.
I was cutting the information from here to the brain, and the jamming, so then it was feeling the sense of heat, but it was exactly the same temperature. This is neuromodulation.
I see.
Okay, we are almost to the temperature 44.
So you're activating the touch neurons that will
Yeah,
cross the pain, inhibit the pain?
Yes,
Okay. Then,
because this is working in the gate system control,
right.
so that's why we jam the signal from here, sensation to the brain, then
It's all electromagnetic, or there's some electric?
Both.
So you have electricity too?
no, inside. It's the modulation to induce to the cells.
No, the energy coming out, is it electromagnetic?
Yeah.
It's
It's
not
electric.
electrical current,
No, it's electric. No, no.
it's electrical magnetic.
There is no galvanic contact.
Okay,
It's,
no galvanic current, okay.
Yeah, it's,
Okay, gotcha.
So where you got the chemotherapy agent? Where are you going to give him chemotherapy
We already gave him doxorubicin,
yeah.
10 milligram.
already?
Yes, but when we change to Doxil, I would just go with 1 milligram. Because the nano itself, it helps us to lower it even low.
So did you give him a tablet or?
No, IV.
IV.
IV doxorubicin, and we give them 2 photosensitizers, ICG, methylene blue, and we give them curcumin to increase sensitivity. According to all the new publications, the 2 reagent that has tendency to attract to the cancer is ICG and methylene blue. Methylene blue has even more than ICG attracting the cancers. But still, ICG is good because it's nanoparticles, so we're expecting they're getting in. But we're going to test that. You know, those people are doing the bio thing. We're going to see if they can see cancer cells loaded with ICG and methylene blue. They have a system using the fluoroscopy microscope. I don't think it's hard for them to find out. And if that's the case, then it's better than what they have currently, because now we don't have any limitation. You're not detecting only cancer has a certain receptors, and only one type. You'll be detecting any kind of cancer. So I'm hoping I can work with those companies and expand and better their products. And knowing also, and to validate also Dr. Shakira, if he say, I don't see anything in the blood, and those people say, oh, there is something in the blood, and we saw the ICG loaded cancer cells, or we don't see it, so that helps to confirm also Dr. Shakira testing.
From Holland, winter.
Is it hot? No, no, but you feel it today.
Yeah,
Yeah, but very little.
But it doesn't affect. You can still take it. Okay, otherwise I can take out the heat that you don't feel any no heat. You want to feel the heat.
lekker.
Lekker. I just want to say something about the hypothermia machine. There's, it heats up to 40 degrees, but you don't really feel it. But some people are very sensitive and feel there's some,
40 in the surface. Huh?
yeah,
Deep it's 40 degrees.
4 more degrees, yeah, 40, so it actually becomes 44. That's why it activates the cells to disguise themselves and put out the umbrella and say, and then your medicine can target that cells. So if it says 40, it will actually be 45 because it's inside. But there is we can suppress the heat if you don't want to feel the heat. But 40, we lie in the sun and it's higher than 40. But we can also deactivate the heat factor. So I was just asking Mr. Boone, he wants the heat, he says, no, it's lekker.
And we're going to do it for a second as well. Microwave.
For the coccyx, okay.
Yeah. So it's. And then you tell us what you feel tomorrow after we're doing the microwave in your coccyx, because possibly it may help to, especially with methylene blue.
Yeah.
Methylene blue is anesthetic, so they're using it for pain, and they reach out to all those bad nerves, and you call them neuroma, and they attract to it and they destroy them, possibly with microwave. We will be able to, if it's neuroma, so that's what I think. They say it's not cancer, but it could be neuroma. Either way, it's good to do it.
You have still other pain in your coccyx area.
Yeah, yeah.
Then you can just treatment.
Yeah, we can give him 30 minutes in his coccyx
Yeah.
as well, right? Yeah. So, some of you will be saying, is the only 4 drugs that we're going to use for all the patients with all different cancers? The answer is yes. The reason why we choose ICG and methylene blue, because those are the 2 drugs that has the highest tendency to attract to the cancer cells. Versus naked chemotherapy that goes everywhere. The only thing that we can attract cancer to attract to the cancer is only those 2 drugs. They have such tendency to attract, especially methylene blue. So that's why I choose them too. And we choose one doxorubicin or Doxil because that's the only drug. Well, there's another drug, but that's one of the drugs that the chemotherapy FDA approved now. All other drugs are naked except Doxil. So that's why I'm choosing Doxil. And all the articles shows the synergy between Doxil and curcumin, Doxil and ICG. We have all the articles to show the synergy between those 3, and then the curcumin to increase the sensitivity of cancer stem cells to the chemotherapy, and we have all the publication that shows that. So that's the reason I'm choosing this 4, because it lines up with photodynamic therapy, and currently that's the best that we have, and we're able to get it in a form of nano. But our future is to change all the chemo drugs into nano, and once we do that, then then testing it, not just giving it without being tested that the patients are sensitive to it or not. So in the future, we will not see people are copycat doing, okay, this is for breast cancer, so all of them, they have to use this certain drugs. That's not going to be in the future. The cancer drugs will be selected based on the sensitivity, which I think this company is able to do that. And this new field of medicine is called personalized medicine. And I think all the patients, before we give them doxorubicin or before we give them cisplatin is going to be nano. We're going to nano it. And curcumin. We will make sure that the patients are sensitive to them before we give it to the patients.
The light is where exactly here?
So the light is in the esophagus here. We're expecting it here. Yes.
Okay.
So hopefully it covers this area.
This is 360 degrees like this.
Right.
So it can eliminate this and this.
Right, that's what we are hoping with red and infrared from inside. It would be good if they have the 30-watt infrared and high watt from outside as well, or we put fiber optics possibly. That's something we're gonna try to work on it. It would be good if we can reach the tumor, but sometimes those tumors, they are in an area it's hard to reach with the fiber optics. So we try to do conservative as much as you can. if we don't see any response, then we need to go more invasive.
So each one is for different lights.
Yeah, so we're gonna do red, and then blue for dark cell, red for metal and blue, and then we have the infrared for ICG. But the blue does both curcumin and dark cell. And then with your microwave, hopefully that will activate those two drugs as well, and gets deeper, so we don't need to poke you with needles.
Exactly. Because when you do the vasodilatation, you can easily imagine that the drugs will go very deep.
Right. So that's what we are hoping.
Yeah.
But if 3 months we don't see any improvement, we'll be starting poking you, making sure it's getting into them. And maybe radio ablation, whatever, we don't just be satisfied with this. We have to find more answer, more invasive. Hopefully this will be it.
You're in pain.
No. Only when I'm standing. Everyone.
Publications already published.
Like pictures before you go in the bed.
Yeah.
Because you stand like this.
So if I will share with you,
Sometimes they will say correct.
Yeah, you change the position of your
Met de bovenspijn en de bovenkant en I stand. And nobody knows
the
what it is.
publications are there.
because it's on the bone.
It's all about the insurance.
The corpse is
They're
very
control of what they're going to pay. They don't want to see any new regime or any new treatment.
You just get the patient
to pay for it.
in Switzerland with the same.
Well, photodynamic therapy is established. Everybody knows it.
Success area?
And
Ja,
It's clear.
en Luna has to make MRI scan. And then last time in Holland, 3 weeks
I can give you all the evidence that they don't need to like stash.
Yeah. It's a man that she cannot send it to China, die cannot find. Dus, en dokter,
But there are some of them are really
ja, die hebben wel de scans.
and yes, you give
Was it never-
you send me that email, I'll find my
Yeah, it's got-
card
yeah.
somewhere in my give you my card, and I will send you all the publications related to what we are trying to do.
Because that's the big obstacle to
Well, even if you give them the monetary publications, if there is a mindset of money driven and there's big pharma influence, they're not going to budge. So it's all about the mayors and the government to really also enforce photodynamic therapy to be accepted. I don't know, South Africa, they shouldn't pay for photodynamic therapy, but they don't. Yeah, so it's all about right. And that's where things is changing because nanomedicine is going to redefine the whole regime again, and they're going to lower the dose of it because there's no need for high dose when you do that. And when you activate them, still you need to get even lower. Yeah, so it's all about the government. If you're able to lobby and you have a relationship with government and the government enforce legislation and enforce the insurance and the medical community to adapt the therapy, and all they need to do is just adapt photodynamic therapy and pay for it. That's the only thing they need to do. And then the details and what drugs you use and what not, that can be sorted out. But if they don't do anything related to dynamic therapy, then there's a big problem there. Okay, so let's switch to infrared. Is this infrared? To what?
This one.
This one.
Yeah, there's the one over there. Yeah, that's station.
Another 30 minutes. Okay, if you have any question, you can ask me at any time. I'm still here, but I will release the mic.
That is amazing. And this is a specific
It just keeps on going down, you know, going down, and it keeps on falling back. I don't know. It doesn't stay.
Yeah, because probably
But now we have some questions. It's all. You're ready, so
this one.
So is this one for the outside?
Yes.
And this one? So how long does it have to be baked? Did you say 42?
44. 1 hour.
1 hour.
So let's say it takes 10 minutes to reach the temperature, and then after, you can say 15 minutes at 44.
And then it must stay at the same temperature the whole time. So is this one
Automatically the main heat.
Okay, so
the
is this
temperature.
dropping because it was a 38 just now?
No, because you will be too cold and then we can turn it. That's the difficulty here to warm is because the lamp. And the lamp there is a current inside. So it's the cavity microwave cannot warm and empty area. Even when we treat the ladder, we have to bring the water to the
So will this give pain as well, did you say? Because I have a friend who's had bladder chemotherapy, inflammation of the nerves.
with the lower back here, L4, L5, S1, S2.
So in my case, if I had, would I have the same place
Yes. In the lamp.
in the lung?
Yep.
Yeah? Or would I do it in the back?
No. No problem.
And why do you do it from the front and not from the back?
Yeah, because it's a closer.
Because when I do some now, they say it's too that part.
Yeah.
It's
But for us,
just to eat it, it's better.
we have 15 centimeters. No. 15 is with this.
Yeah.
The volume is 10 centimeters.
So fat anymore, skinny now. I'm the chemo.
I'm sure we do.
You're this 15.
But usually it's better to treat the lamp from the way. For you, it's more.
And then you treat in the middle for the
Yes.
an hour,
In the
yeah?
kidney.
En dan morgen nog een dag.
So I'm impaired. I've got two pairs in the boat.
When we treat them, we treat the lungs. It's 3 times.
Okay, so I'll come. So I'll do 5 days in a week. I'll do 3 days kidneys and 2 days lungs. Kidneys and lungs.
Two times twice. So let's say Tuesday and Thursday, and Monday, Wednesday, Friday.
For 2 weeks and then you see.
Temperature.
Can you feel that here?
No.
At the beginning, yes.
Ja. Nee, hier.
Irritating.
Nee, niet irritant.
Now it's off, no?
Infrared. You cannot see it in infrared.
No, infrared. Now it's in infrared.
Yeah.
I switch or so that's maintain the temperature. The night, and when we press the coccyx from outside, and we clean, it's clean. No. If it's looking. So tomorrow I saw that Luna, tomorrow I'm coming and we do for you in the coccyx area pure injection of protein. With a little pain also to get anesthesia, and we put the in there. You will see what response. Make sure you get the response to it. Because we inject. Here is the IV. But it's better to put the treatment where we need it. Exactly. Subcutaneously, you know.
It's strange. I have pain over 4 years now. Everybody and make pictures and all.
Did the CT scan was impossible to see?
Yeah, you cannot find it.
Only the MRI.
Ja. Once time Dr. Seed and once time Dr. Seed not.
But there is this is normal with a CT scan. Okay, it's totally normal. But we have to use all MRI or PET scan.
Yeah.
PET scan from the CT scan. The one most expensive is the PET scan. But tomorrow we try that with the lidocaine. You can get lidocaine with the curcumin with injection. And explain to you what we do with the local protein injection and if you can get lidocaine more pharmacy or whatever.
Yes, I'm doing now. That's now. Yeah.
Then we'll see with you, but let's see how we can manage that, and if not, but it's better now, you get more energy. No, because your daughter yesterday told me that you was tired a little bit. You get
No, I was good for.
but now it's okay.
I will look at
Actually, do some details.
Ja, ja, ja. Correctamente relax.
But we now that we have everything to handle clear the situation. And then the MRI is showing at the end of the two lamp,
Ja,
you have small spots. Okay.
nou, dit.
I think
De MRI die hij mee, of de CT-scan die hij mee in Holland, was bigger than before.
so. Then
And look how we are making a MRI scan of a PET scan, and you can see the information.
So then we must do the protocol before to clear this area. You see the one, so
People, thank you very much. This is the last for the day, so we're just waiting for the patients to finish. Then we're going to end up and we will hopefully see you tomorrow on at 8 o'clock. Thank you.